Hello, everyone, and welcome to this audio podcast and this series, The Extracts Equilibrium. This is a Storm Robotics production as part of a sort of a research retrospective. This will be a sort of an extract surrounding works on how can technology overcome barriers facing community pharmacists to fulfill future practice. So yes, again, an extract surrounding how can technology overcome barriers facing community pharmacists to fulfill future practice. And so the extract is thus. So it is evident that community pharmacists' clinical knowledge is being or has been being utilized by numerous sort of patient-centered care services. Excuse me, and the role is expanding, or the role has been expanding within the primary care sector. And whilst pharmacy profession is sort of revolutionizing, at least in some context, the community pharmacy environment is not or has not been. And so, as the focus remains on the dispense and supply process in the main, technology has been shown to improve sort of efficiency and safety through numerous methods or modalities from improvements in dispensing and management of medicines. So this work look to or seek to identify the perception of community pharmacists on the future of the profession, and seek to identify the technological requirements needed to support and enhance these roles. So, in part of this works, the methodology that sort of took place, excuse me, two focus groups, for example, with 11 participants, were conducted through a semi-structured modality or method, which were then transcribed and wherein again verbatim was also recorded. Thematic analysis with an inductive approach was undertaken to identify three main themes. The data collected during this research was then used to format a survey to aid further or prospective research. The future of community pharmacy and the future of community pharmacy community pharmacy and the barriers to future role of the future role and future technological requirements were particularly the main three themes that had been highlighted. And moving away from dispensing and towards more clinical roles in some contexts was identified as a sort of a prospective aspiration for those who had been involved involved as participants in the interviews. The inability to access patient records, time spent accuracy checking, and the recent funding cuts were some of the barriers that had been discussed by the participants. Technological advancements to improve supply, the patient's experience, and in integration and documentation are necessary or have been necessary to support pharmacists sort of prospectively. Access to sort of electronic health records, or EHRs, or electronic patient records, if you like, EPRs, was also identified as a prospective requirement to ensure patient safety. Technological records or technological advancements should aim to overcome the barriers identified and sort of tackle or challenge the current limitations of technology to ensure that a future or prospective role of community pharmacists can be achieved without compromise. The investigations results were used in part by within industry to improve sort of areas of current practice and enable community sort of pharmacists to utilize skill base, which in turn sought to result in sort of more efficient sort of health aspects of practice, wherein the National Health Service or NHS was concerned. So, I'd like to acknowledge Bowen A. For conducting this research, wherein there was a collaborative effort between Cardiff University, University in the UK, and within industry as well. The organisation in the UK, and once again, it was nice to be involved in supervising or co-supervising this works as well. Once again, thank you for tuning in on this audio podcast in around the extracts equilibrium. And once again, this is a Shientist, and it's been another Storm Robotics production. Thank you.